My name is Thanks. My name's Nick Lomax. I'm going to be chairing this session. So I'm a professor of population geography, based in the School of Geography at the University of Leeds. I'm also a fellow at the Alan Turing Institute, which is our National Institute for Data Science and Artificial Intelligence. And one of the other things I do is that I'm co-director of the ESRC-funded Consumer Data Research Centre, which is where I've got the pleasure of collaborating with our upcoming speaker. So it's my pleasure to welcome you to this webinar of the Global Food and Environment Institute, the GFEI. The talk that we're going to see is called Dietary Patterns in UK Consumer Purchase Data. We're going to hear from our presenter, Professor Michelle Morris. So Michelle is Professor of Data Science for Food at the School of Food Science and Nutrition, based at the University of Leeds. Michelle's also a Turing Fellow at the National Institute for Data Science and Artificial Intelligence. Michelle leads on interdisciplinary nutrition and lifestyle analytics teams, and they use novel forms of data, which include supermarket transactions, records from UK supermarkets, for research into lifestyle behaviours and health. Michelle's an investigator on the ESRC-funded Consumer Data Research Centre. As I say, that's where we have the pleasure of collaborating. She's also an investigator on the UKRI, TU KFS-funded biofood and diofood projects, and she's the principal investigator for the Institute for Grocery Distribution-funded Health and Sustainable Diets programme. So a bit about the GFEI. So the Global Food and Environment Institute is an interdisciplinary research community. It brings together members from academia, industry, and public policy to work on the integrated challenges of food security and climate change. So for further information, there are plenty of links in the chat, but you can go to leeds.ac.uk/global food, or if you like X, Twitter, look for @globalfoodleeds. So quickly, just before I introduce Michelle, our speaker, I'd like to remind you of the seminar etiquette. Please can you make sure that your cameras and microphones are off and stay off for the duration. Michelle's going to talk for 20 minutes, and I hope we'll have a good amount of time for questions at the end. If you'd like to put your questions into the chat function, I will collate those and present them to Michelle at the end of her talk. Last reminder for you is that this seminar is being recorded and the recording is going to be made available via YouTube. So with the preliminaries out of the way, it's a pleasure to introduce you to Michelle Morris.
Brilliant. Thank you very much, Nick, and thanks for such a comprehensive introduction. That saves me doing that again. So I will just dive straight into the content of the talk. Well, thanks very much to GFEI for inviting me, and Nick for chairing, and all of you for joining to hear about some of the work that myself and the team have been doing over the last few years. So just before I get started then, I just wanted to acknowledge the funders of this research, so UKRI through the Consumer Data Research Centre, and IGD through their funded programme of evaluation of their healthy and sustainable diets trials, and also ESRC for some studentship funding for Vicky Jennison. So I also wanted to declare that I do work in collaboration with multiple large retailers, the IGD, the social impact arm of IGD, but they are funded by industry, and Consumer Group, and I'm an inventor shareholder at Dietary Assessment Limited. So I hope that you agree that these declarations are not necessarily conflicts in this setting, but also just show how dedicated I am to trying to drive change in dietary assessment, dietary evaluation and behaviour. So many colleagues have contributed to the work I'm going to present, but special thanks to Vicky Jennison and Stephen Clark for some of this work that's coming up. So on to the why then. So I guess this audience, most of you probably well aware that 1 in 5 deaths globally are attributed to poor diet. Food production accounts for 1/3 of our global greenhouse gas emissions, and global food insecurity has more than doubled since 2020, and currently 1 in 5 families with children in the UK are living with food insecurity. So food is at the heart of some of the world's and the UK's biggest problems. So it's really important that we drive change to improve health, reduce deaths, and reduce greenhouse gas emissions and reduce food insecurity. So for the next 20 minutes, I'm going to introduce you to supermarket transaction data, talk about the differences between purchase data and consumption data and the contexts that they're useful, and then talk you through some dietary patterns that we observe in transaction data and how transaction data can be used to to evaluate interventions that are designed to change behaviours. So it'll be a whistle-stop tour. So then, as an introduction, as many of you will be aware, traditionally when we collect information about diet, it's through diet diaries or questionnaires where you tick a box for how frequently you consume particular foods. In recent years, these have been moved online or in electronic form, which is much better for researchers and participants. But they still have quite a lot of both researcher and participant burden, and there can be a time delay and challenges in scaling the reach of the people that we collect this data from. And they collect information on consumption, so what people report they have eaten. But all the time now, we're generating information or novel sources of information, digital footprint information, or smart data about what our food behaviours. So many of us will use loyalty cards at the supermarket to get points, and that tracks our shopping behaviour over time in supermarkets. Loyalty cards are also available for out of home, and we also then additionally just have transactions from supermarkets. So this data is being generated at a rate of knots and is available for research with some caveats. But the important parts are it is really timely because it can be almost real time, and it's scalable. This is available for the majority of our population. So therefore, I feel strongly that it's got a place in dietary and food research, and I'll give you some examples and see if I can bring you on the journey too. So first of all, though, I mentioned that purchase data are not the same as self-reported food consumption. One's something we buy, we don't know that it was eaten, we don't know who in the family ate it. There's lots of different questions, but arguably it's more objective because you're buying it with the intention to consume. And then those that have involved with self-reported consumption information, that's prone to a whole load of bias around, only not remembering what you ate previously or not wanting to record it and report it. So how do we know how well these two things compare? So a few years ago, Vicky Jennison, as part of her PhD, set up the STRIDE study, which was to quantify the agreements and more specifically the limits to the agreement between supermarket purchases and self-reported intake. So the two questions here were, how well do transactions represent intake, and in what context can the transactions be used for dietary monitoring? So there's a whole talk about this study. It was a big undertaking, but I'm going to just fast forward to the results that set up the story for what I'm going to talk to you about next. So we recruited participants into a study where they completed a food frequency questionnaire and shared their historical transaction data. And we did this across 4 seasons of the year. There were 686 people who completed the FFQ, the surveys, and shared their data. And if you look at the right-hand column here, this is the information from the food frequency questionnaire, so the absolute consumption per day for the individual taking part in the survey. And on average, they reported having 1,955 calories per day. If we look at the transaction data, so the supermarket transaction data for a loyalty card holder is representative of the absolute household purchase per day. So we don't know how many people are in the household. This is 1,746 calories per day. So it's only about 80% of what an individual reports consuming. But then if we manipulate this data to estimate what we think that the person that we've collected data from actually consumed within that purchases, it can reduce down to just over 900 calories, so about 50% of what they said they ate. So this is suggesting that supermarket transaction data might not be that great if you're interested in absolute measures of dietary components, as you see here. But if we think about energy adjusted nutrient estimates, so the total or dietary composition or dietary pattern, the percentage energy from particular nutrients are so close to the energy adjusted consumption values. So if we think about So this is almost 90%, and it's even better than 90%. So you can see for saturated fat, the percentage of energy from saturated fat is the same in both the transaction data and in the self-reported FFQ. So we can conclude then from that supermarket transactions represent intake poorly if you're interested in absolute intake. There are various caveats. So this data was from a single retailer. It was participants who signed up to take part in the study. We also did some subgroup analysis, and within that subgroup analysis, we found that for those loyal customers, purchases are a really good proxy for dietary composition. So if we're thinking about dietary composition, dietary patterns, supermarket transaction data are really good. So then what do transactions tell us about population diet in terms of dietary patterns? So we have a sample of loyalty card holders, or regular shoppers. So these data for the first part of this study from Stephen Clark that we worked on a few years ago, uses 300,000 loyalty card holders in Yorkshire and Humber from 2016. So it's a full 12 months of data. So there's hundreds of millions of rows of transactions in this data because we have individual products. So, it was 2 cans of Heinz baked beans, 6 cans of beer, the exact product that you had, and the nutrient composition data as well as for each of those. And we assigned each of these into 82 food categories that align with the Living Cost and Food Survey categories. So the sample is predominantly female, so 65% of the loyalty card holders were women in the age group of 45 to 54. And in the bottom left here, you can see that we're overrepresented by those living in the least deprived areas. So the pluses on the chart are what we'd expect in the Yorkshire and the Humber, and the bars are what we have in our sample. So we're overrepresented by the least deprived and underrepresented in the most deprived. But what I want to say here is while we're underrepresented with only 6% in the most deprived, that's nearly 20,000 people. So it's still a huge amount of people. And the bottom right, so this is the output area classification geodemographics, which is a composite index that brings in various different demographic characteristics linked to where they live. And what it's showing you is that in our sample, we're overrepresented by people living in leafy rural areas and people typified as urbanites and suburbanites. So while we get onto dietary patterns then for these people, just a reminder that these are our national recommendations, the Eat Well Guide. So a third of your plate from fruit and veg, a third from starchy products, ideally more whole grains, and then the other third is made up of protein-rich products, dairy, and oils and spreads. You'll see on here that on the bottom left of the diagram, we've got examples of things we should eat less often and in small amounts, so sweets, biscuits, crisps. So in the guidance, these should be no more than 3%, but they keep them off the plate of the diagram because we don't actually need them for our diets. So if we think about these then and what that would look like if we put it into a donut plot, this is what the recommendations would look like. And you may not be surprised to see that the purchases made by those 300,000 shoppers in 2016 did not align with the recommendations. Almost a quarter, or exactly a quarter of food purchase fell into that discretionary category, so those sweets and biscuits. I was quite surprised that as much as a quarter were from fruit and veg, but we have a lot more protein-rich foods and not enough starchy foods in there. And while oils and spreads is only 2%, it's actually double the recommendations, and we're 50% higher than the recommendations for dairy as well. So we had to kind of fit the data against those categories to look at the Eat Well Guide. And another way of looking at this is using the data to tell us what dietary patterns exist. So we use k-means clustering method to identify 7 data-driven dietary patterns from those transaction data against the 82 food categories. So I'm going to just explain a couple of these to you to illustrate what they look like. So the most healthy, with our subjective name here in ordering, is one that we call Fruity, which was purchased by nearly 60,000 customers. And what you can see on the radar plot is that the most popular food purchase were pears, and they were purchased 2.5 times more than the average shopper purchased them. And on the right-hand side, you can see the top 10 favourite purchases and the least popular purchases for this cluster of people. And you can see that those popular foods are dominated by fruits, which is why we've called this pattern fruity. And at the other end of the scale, alcopops and ciders, soft drinks, and ready meals were amongst the least popular purchases. We go to the dietary pattern that we consider to be least healthy. This was one we called sweet tooth, with over 30,000 consumers buying it. And you can see that the most popular product in this pattern was soft drinks, consumed at 3.5 times the average shopper. And in that top 10, we've got soft drinks, alcopops, other sugar products, confectionery, and at the other end of the scale, in the least popular, we've got fresh vegetables and some fruits. So you can see these two contrasting dietary patterns. If we look at the nutrient profiles for these patterns, we can see the adult reference intake on the left of this table, followed by the overall patterns of the purchasing of the consumers. I do just want to show you here that the average calories purchased per day for these customers, these 300,000 customers just from Yorkshire and the Humber, was 1,757, and it's household level. And if you remember from the STRIDE study, the average calories purchased was 1,746. So, 10 calories different, but in the sample in the other study, it was recruited from multiple regions in 2020 and 2021, so a completely different time frame, yet they are extremely close. So I think we can be quite confident that this is the amount of calories kind of purchased by customers in supermarkets. But to draw your attention to the patterns of interest then, so if we think about a marker of healthiness, the recommended intake for fibre per day is 30 grams. In our most healthy pattern, there's only 21 grams of fibre purchased per day, and that's at household level. And in the least healthy pattern, it's just 10 grams of fibre purchased. If we think about it from a socioeconomic profile and look at the deprivation, you can see that the lowest 10%, so the most deprived people, our sample is 6%, comprises 6% in that decile. But within the sweet tooth dietary pattern, it's 10% of that cluster of shoppers actually live within the most deprived areas. And we can contrast that with the fruity pattern, where it's less at 4%. And we can see that the least deprived in those highest deciles are consuming the highest proportion of that most healthy pattern. So we're interested then, these patterns are suggesting there's a lot of people not meeting dietary requirements, which we know from other research as well. But what actually works to shift dietary behaviours? Because after all, this is what we all want to know, what policymakers want to know, and I think as well what us as consumers of food also want to know. So if we think back to what I showed you about what people are actually purchasing compared to recommended, we've done some work in different areas, but in the I'm going to give you an example from trying to increase this fruit and veg part of the Eat Well guide. So this is the work that we've done in collaboration with IGD, but also in this example with the supermarket Sainsbury's. So we recognizing that it's low-income customers that perhaps need the most support with increasing their fruit and veg consumption. And it's also these customers that are eligible for the Healthy Start voucher. So Healthy Start voucher is a government top-up voucher for families where the woman is pregnant or they have young children in the house, and they're able to get a voucher for £4.50 a week to spend on fruit, veg, pulses or milk products. There's a lot of campaigning ongoing to raise the value of this voucher because it just doesn't get families enough. But alongside that, a number of different supermarkets have offered top-up vouchers, and Sainsbury's offered a £2 top-up voucher for every Healthy Start voucher that was used. So this was offered between February and August 2021. And when they redeemed the then paper voucher from Healthy Start, they were printed out an additional £2 voucher for their next shop. So we looked at the impact on fruit and veg within the basket. We also examined the impact on the Eat Well guide and looked at whether this was significant or not using interrupted time series modelling. So what I'm showing you here isn't actually the ITS models, but this shows you a lot of information, but we'll go to the plot first. So we had data from 2019 as baseline. And we compared then the change in Eat Well Guide proportions with the baseline for each month throughout the year. The reason we had 2019 as a baseline was because I'm sure everyone will remember that 2020 and 2021 was a challenging shopping environment because of the challenging environment for pretty much everything, but for going to the supermarket as well because of the COVID-19 pandemic. So across the bar at the bottom are all the different stages of lockdown. So if diet stayed exactly the same as the same time period in 2019, all of these lines would be at 0. But what you can see here is that the discretionary food line, which is in orange, interestingly peaked through the first lockdown period, but overall during the period of time and most significantly during the intervention period, that proportion decreased, and it corresponded with an increase in the proportion of the basket assigned to fruit and vegetables during the intervention. And we've included protein-rich foods on here as well. So what that actually meant overall within the people who were using the in the baskets where an actual voucher was redeemed is that there were 13 more portions of fruit and veg in baskets that redeemed a £2 top-up voucher compared to baskets in the same shoppers when they weren't redeeming a top-up voucher. In only 17% of the printed vouchers were actually redeemed, which I found pretty shocking, but this is actually 3 times higher than typically for paper vouchers printed in a supermarket. And 98% of the customers redeemed the full £2 on the fruit and vegetables. And some of the ones that didn't were like redeeming £1.98. So, really very close. So with this, we found was, really good evidence that when you actually give families who are struggling money to spend on fruit and veg, they do. They really want to feed their children fruit and veg, but there are other constraints on their budgets. So we did look about whether there was a significant change 3 months after this intervention, and we found it was small but statistically significant. They kind of maintained behaviour. So what was really good following this is that we presented the results to lots of different organisations, including Department of Health and Social Care and the NHS Business Services Group, who manage the Healthy Start vouchers. But it also went back into Sainsbury's board, and they decided to roll out the programme again for a further 6 months, which they estimated would support over 500,000 low-income families with extra fruit and vegetables. So this was a real whistle-stop tour, but to summarise this, supermarket transaction data, I believe, do have utility in dietary research, but we need to remember that context is important. And that's kind of going back to the fact that purchases and consumption data, they do represent something different. But the transaction data reveal interesting dietary patterns, which are important for us to understand population behaviours, so that we can then look at the best ways of changing those behaviours. And that these data provide timely and scalable way to evaluate retail interventions as well. So I've just provided you with one example in this talk, but we've evaluated a number of different interventions around healthy and sustainable diets in a number of different retailers over the last couple of years. And the transaction data have been able to, provide kind of an objective and robust evaluation. And that I really do believe that transaction data are an important tool as part of a wider toolkit to tackle challenges around population health, planetary health, and food insecurity, with food at the centre. So I had 20 minutes, so I think I've actually managed to stick to 20 minutes. So I just want to say thank you very much to everyone for listening, and very happy to take questions.
Thanks, Michelle. You were indeed spot on time. That was brilliant. So we've got some questions coming in. So just a reminder to people, as I start to ask these questions, please do pop them in the chat and I'll pose them to Michelle as they come in. So a question from Roger. So Roger asks, are there any differences in data from in-store buying versus online buying? So in-store promotions to healthy purchases versus online promotion for healthy purchasing. So yeah, could you say something about that, maybe the different channels of purchase?
Yeah, so we haven't looked specifically at whether there's a difference between online and in-store purchasing patterns, but I'm pretty sure that other people have at least have looked at that and further into the past. But the data that we did get does contain whether it was bought in store or online. So it's something that we could look at in the future. And like with some of the interventions that we're evaluating have been online, some have been in store, and some have been a combination of the both. But yeah, I don't have the answer to hand for that one. So sorry about that.
I wonder if it might be when you're online, you actually have more time to think about the offers, don't you? So maybe there's a completely different dynamic there if people have more kind of breathing space to think about what what the offer looks like.
Yeah, the methods of promotion are different as well. So, I mean, in some other work that we're doing, kind of evaluating the impact of the high fat, salt, sugar legislation, the way it's been rolled out online and in store are different. So, I think you are kind of in a different food environment on many different ways when you're in store, online versus in store. Because in both environments, different people will go directly to what they want, and others will be more prone to the whether it's a banner on the end of an aisle or whether it's did you forget promotion or even just the advert, like a poster for it that you then triggers you to go and search for if it's online. So yeah, there's a lot of work that we could do in that one. So it's a really good question.
Thanks, Michelle. This is Janet Cade. So this is it's more of a comment for you, but the lower calories in the lower income groups potentially reflect more calories consumed from other sources like fast food. So presumably that's picking up on the whole portion of the Eat Well guide that isn't, in the data.
Yeah, absolutely. So I think it's about, for the average person, it's about 90% of the food we consume at home comes from supermarkets, but that doesn't account for how much we eat out. So, and anecdotally, from some of the kind of community work type group we've done before, I've heard families saying that it's a challenge and it's expensive to get to a supermarket, in that you might have to get a taxi both ways, or make sure your children are home to carry it, and if it's uphill it's not necessarily appealing. So if there's a takeaway closer, they are more prone to that. And there's some work that colleagues like yourself, Nick, was involved with in the Consumer Data Research Centre that actually show that people living in the more deprived areas buy fast food in lower amounts but more frequently compared to the more affluent areas where it's less frequent, but when they do buy takeaway foods, it's in a higher value amount. So you could suggest volume perhaps as well.
This question, interesting, some potentially parallel work. This is from Andy Hill. So it says it reminds them of some work which was looking with Leeds City Council discounting of attendance at sports and leisure facilities. So the question is, have you done any health economic evaluation on the fruit veg discount tokens?
The short answer is no, we haven't. But yeah, maybe we can chat about that.
It's a question from Mel Yan. So Mel asks, has pricing of food been factored into the analysis? So people may be purchasing more because they are cheaper. So the actual items themselves might be cheaper. So people purchasing more of those things.
Yeah, so one of the things that's always a challenge when doing anything with transaction data is that you don't know what else has been going on in the store at the same time. So we can look at the amount that somebody paid, but not necessarily about whether that was on promotion at the time in the standard data that we've looked at. We have also done some work where we reduced the price of fruit and veg for everybody at certain selected fruit and vegetables items. And during the period that it ran for 4 weeks, and for the first 3 weeks of that period, you did see people buying more because it was cheaper and therefore kind of more accessible to them. But it only lasted for 3 weeks in the over 100 stores that trial ran in.
There's possibly something going on the other way around as well, which is in your kind of more adherent groups who are kind of seen as being more healthy. They might at some points also buy things that are less healthy if they're on offer. Like if you've got the need to, you then bulk buy stuff that's going to keep. So the store cupboard staples. So it's very hard to unpick that, but actually understanding the discount at the time of the purchase would be a really interesting additional avenue, I think.
Yeah, we're just in a different project. We're having some conversations about getting the specific promotional information as well. So hopefully getting everybody excited about there's a lot of scope for work in this area.
Question for you from Liz. So it says, have you started to investigate the impact of food inflation on purchasing patterns? So that's Lizzie Dolan at the University of Nottingham. So food inflation and how is that changing the patterning?
Yeah, so we've got a project that's ongoing at the moment, Lizzie, where we're not specifically looking at the impact of food inflation. We're looking at the impact of the high fat, salt, sugar legislation, but have that information on cost so that we can kind of control for inflation and also have controls where the legislation wasn't implemented. Because, yeah, absolutely, food inflation is having a big impact on shoppers. So I think some of that will be unpicked, but not in a specific question about food inflation, but around impact of an intervention while food inflation is happening at the same time.
I took the liberty as the chair to also post a question in the chat, so I'll ask my own question, which is around. I think we have sort of picked up on this, Michelle, but I'm interested in that translation of the purchasing to the consumption pattern. So you obviously talked a bit about it, but people purchase for their families, and the translation of what you buy isn't always the same thing as what you consume, especially if things are cheap, because there is a tendency that you might be more inclined to throw things away if they haven't cost you a lot of money. So I don't know if you can say more. I know you said some really interesting things about the calories, but is there any more that you could say? And I'm kind of thinking about those adjustment factors, assumptions, all of that kind of stuff.
Yeah, so when you purchase food, there are readily available adjustment factors for things like if you're buying beef on the bone, there's adjustment factors for adjusting the fact that you don't eat the bone so that the calories are not attributed to that. Same with things like, bananas and banana peels. We've got edible portions there. There is information available around kind of the average waste across food categories. So you could start adjusting for waste. Depends on what the context of the question is, because if we're thinking about sustainability, if you bought it, the greenhouse gas emissions for producing it, you just need to be accounted for. It's just the not for cook, and then maybe you wasted it before or after cooking. So it depends what the question is. So there is that, and the attributing it to the person in the household. So in the work that Vicky did, she did collect information for the STRIDE study. And I've seen that Darren Green was on the call as well. So this was with Darren, myself, and Graham Clark supervising. We did collect information about household composition. So some of that where we had the household versus individual was using the recommended intake for parents and children of the ages that were reported in our survey for those living in the house. And then we attributed the proportion of what was bought to the people kind of based on recommendations. So it's a long way from perfect, but that's how we got to that individual purchases estimate. We do have another project ongoing at the moment, which is the UK transforming food systems work, looking at food insecurity in people living with obesity. And we're using that data from STRIDE in combination with a much bigger set of transaction records to try and attribute kind of population weightings. So using kind of census data combined with the characteristics of the sorts of people that shop at our retailer to try and generate weightings. There's some really interesting work done by colleagues in Finland, and we've replicated some of this on a small scale in Leeds, where they've added that demographic weighting. So for example, in Finland, they found that men consumed a lot more meat, but that women are the main household shoppers. So if you kind of applied like a demographic weighting based on gender, it would then stop women who were the main shoppers looking like they were buying lots of meat, because you would adjust it for the fact that it was consumed mostly by men. So there are some, and there were multiple examples of that one. So there is work that's moving towards that so that we can start adjusting it better. And then the one that we haven't mentioned, I guess, is that we purchase food, like if we buy pasta or rice, it's dry, and then we do actually, by the time we consume it, we convert it to a greater weight because you add the water and it cooks. So there is conversion factors to get us from as purchased to as consumed. So I think that was a very long answer that kind of illustrates that it's complex. There are many kind of different layers to that. And we're kind of, what I've presented today didn't include any of those, but we are working towards some of that to kind of address those key limitations.
That's great. I think I knew it was complex, and now I appreciate the multifaceted nature of how complex that is. So Michelle, I can't see any more questions in the chat, but we are also doing extremely well with time. So I think I'm going to wrap us up there. So a couple of things to say. One of them is, oh, actually we've got time. So Megan, you've come in with the final question. Can you estimate fiber content of diet?
We can tell you the fiber content of the purchases, yes. So for the vast majority of our data, fiber is available through the back of pack nutrition information. It's not a mandated nutrient, but the majority we do have fiber, or we could probably impute what isn't there. So yeah, that is fiber of purchasing. Whether it was consumed is the limitation there, but yes, we can do fiber of purchases. So hopefully that answers that.
That's brilliant. Michelle, thank you so much. That was super interesting. And thank you very much to our attendees and for all of those brilliant questions. You've got a slide up on the screen at the moment, which gives you links to all of the various places, and Michelle's contact details on there as well. And as I said at the beginning, this talk will be uploaded to YouTube at some point. So thank you very much, and see you again soon.